Gunderson Health System's sustainability program is really pretty much out of the world for a lot of reasons. My name's Tom Thompson and I'm the Sustainability Coordinator at Gunderson Health System. We have a goal. We're going to be energy independent in 2014. We will offset everything that we consume in the entire health system. All 19 counties, all 41 clinics and the hospital and the support buildings and the facilities, we're going to offset all of that energy consumption with renewables. And when we do that, we will be virtually energy independent. We have a CEO, Dr. Thompson, whose vision this is. He is still a practicing neonatologist, so he takes care of the little tiny sick babies. If you think about it, anything that happens in their environment, whether it's a temperature change or chemicals or literally just about anything, it has an impact on their health. And those are his patients. So he takes that out to all of the patients and all of our community and our staff, and actually takes it pretty universally. Our Envision program is the vision of Dr. Thompson. And then we have a team of really terrific people who are working hard on all of our initiatives. Truth is, we have 6,000 employees who are all on the green team. Coordinating sustainability for a health system the size of Gunderson means you have to wear a lot of different hats. You have to work with a lot of different people. Some of it will be on site, like our biomass boiler, our geothermal well system, our landfill gas project in Alaska. Some of them will be off-site at places that we either lease land or we partner with other entities like our wind turbines. One of those projects is set up in Cashton with Organic Valley. And so we're actually on Organic Valley's property, and we have 2 giant wind turbines generating electricity. All of these projects will pay for themselves. Once they do that, they will save money for the organization. So one of the myths that's out there about environmental stewardship is that, it'd be nice to do, but it's going to cost us too much money. Yeah, that's baloney. We're saving on each and every project hundreds of thousands of dollars, and they add up to millions of dollars. These are projects that will last for decades. So a wind turbine, you set it up, you build it, and it's there for 30 years. And it gets paid off in about 7 or 8 years. You do the math. It's a lot of years of free power. It's a benefit environmentally, and it's a benefit economically for our organization. So we call that two-sided green. We have a very robust recycling program. We recycled more than 600 tons of material in the health system last year. And out of that 600 tons, we actually made $70,000. My colleagues out in the world and other health systems, they actually would like to break even and have a cost-neutral situation. We made money. We also, in our recycling program, we try to reuse actually more than what we recycle, or at least get that ahead of the recycling. In our missions program, we capture medical supplies, furniture, all kinds of different items that are kind of going out of service for our hospital. We capture that and we donate it to various organizations for use overseas. And one such example is Cornerstone in Madison. And we recently loaded a box truck full of equipment, probably 4,500 pounds worth of medical supplies and furniture, all kinds of things that we can't use any longer here at Gunderson. A lot of these supplies actually will be going to Honduras to open a new hospital down there. And they are very excited to get this type of material. It's doing the right thing for our community, even our global community. Another exciting thing we're doing at Gunderson that's non-energy related, but it has a big impact on our sustainability program, is our food waste program. A lot of food was getting thrown away, and we wanted to kind of explore that and see what we could do to try and minimize our waste. We have highly trained food safety experts in our kitchen, and they identified a donation opportunity with the Salvation Army. A lot of the food that was getting wasted, that we were throwing away, was actually perfectly fine. It was leftover food from the serving line, leftover from the catering, leftover from the salad bar, and there's nothing wrong with it. It's either been heated or cooled the whole time. That's another way that we can help out, and it's meaningful in our community. And the Salvation Army is very thankful for everything that they get. We've certainly received national recognition. We've gotten the National Award from Practice Green Health for 7 years in a row. We've also sent our CEO to the White House for the Champion of Change Award that is given out for organizations and for people who are leaders in energy and environmental stewardship and healthcare. We've also won local awards and state awards. So we're being recognized in our community and in our state and in the nation for this good work. And what it really says is that our program has been validated, that we're not just kind of randomly going after things, that people recognize that we're doing this and that we are having an impact, which is the most important part. The biggest goal that we have is a goal that is unheard of in healthcare, and that is to be energy independent. We're going to be energy independent in 2014. We will produce more clean, renewable energy than what we consume in the entire health system. And when we achieve that, we will not only be the first health system in this country to achieve that, we'll probably be the first one in the world. Part of the reason we're doing all of this is you don't have to be a scientist to understand that if you pollute the air and the water, people get sick. So it's pretty easy to connect the dots on environmental stewardship and healthcare. And then when you can prove that you can do this and save money, which is what we're doing, well, then why wouldn't others want to copy that? You're doing the right thing for the mission of your organization if you're in healthcare. You're doing the right thing environmentally for your communities, and you're saving money. It's kind of an honor, actually, and it's a privilege to be able to work in a place where, they're caring for our most vulnerable people in our community.